Hello and welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. And just a FYI, I do have some jobs on this video today that includes jobs for doctors. The first company is for Evolent, and the position is a field medical director, interventional pain management. This is full-time, work at home. It was posted 7 days ago. The qualifications, I always go straight to the qualifications, and even if you don't meet all qualifications, I still suggest you apply. Must be MD, DO, or MBBS required. 5 years experience, practice of pain medicine, post-residency preferred, current unrestricted clinical license in medicine, obtaining and maintaining medical licenses in the state you reside, and any required per business needs is required. Active board certification in pain management or active board certification in another specialty, and clinical experience in interventional pain management is required. Strong clinical management, communication, and organizational skills required. Energetic and curious with a passion for quality and value in healthcare required. And computer proficiency is required. And that's that with that job. Next position is with Cohere. This is an associate medical director, cardiology, and the qualifications: you must be a U.S.-based resident in internal medicine and fellowship in cardiology, board certification, MD or DO with active, unrestricted state medical license. Must maintain all required credentials. 5+ years of clinical practice beyond residency or fellowship in internal medicine or cardiology. 1+ years of managed care, utilization management, with utilization review experience was desirable. This is desirable, not required. Membership in national and or regional specialties societies. Licensure in Florida, Minnesota, North Dakota, or Texas is highly desirable. You should be willing to obtain additional licenses, state licenses with Cohere support. I'm going to skip all these. This is a fully remote job, but it has a 5% travel opportunity. And I'm going to pass that up. And the salary is $250 to $270 annually, so on and so forth. And the next job, this is with ClearLink Partners. They're looking for a utilization management RN, California license. This is remote direct hire, posted on the 9th. This job requires you to have experience with transplant NICU. I'm going to pass up that and go to experience here. The current unencumbered California RN license required, compact license preferred, in addition to California license, CalPERS experience, minimum of 5 years of acute clinical experience, 2 years experience in managed care environment across multiple lines of business. That includes Medicare Advantage, managed Medicaid, dual SNP, S&P, commercial, etc. 2 years of utilization management experience. Now, this job requires you to have experience, strong knowledge of utilization management process and industry best practice. I'm going to skip all this. Right here it says proficiency in Microsoft Office. Make sure you add platforms to your resume. Any platforms or software you currently are using on your current job, such as Epic, Cerner, Microsoft Office, Meditech, etc., add to your resume, as well as your previous jobs, any software you've used. You want to promote your tech-savvy skills. We're going to skip the physical requirements, and the salary is $70,000 to $100,000 per year. You'll work from Monday through Friday, 8 a.m. to 5 p.m. Pacific Standard Time. It says travel may be required as needed by client. I've worked as a remote nurse in utilization review for over 9 years, and I've never had to travel anywhere. The next job is also with ClearLink. This is a care management RN compact license. Must reside in South Carolina. This is a direct hire, posted on April 8th. The requirements for this job includes, of course, a compact RN license and must reside in South Carolina. 5 years acute clinical experience, that's bedside. 2 years experience, 2 years experience in managed care environment across multiple lines of business. So this job has the same exact requirements for the previous, and this is Eastern time zone, the same pay rate, $70,000 to $100,000, and of course, still weekdays from 8 a.m. to 5 p.m. and ability to adjust to client schedules as needed. The next position, this is with Pine Park Health. This is an RN position remote. And the qualifications for Pine Park Health are RN license, 2 years clinical experience, preferably in geriatrics or related fields, strong experience in remote roles, showcasing proficiency with technology and digital communication platforms, track record of high accountability, exceptional communication, and the ability to thrive in a fast-paced environment, experience with geriatric patients, particularly in settings like senior living communities or skilled nursing facilities. I'm going to pass up these 2 bullet points and focus on what's next. Is there a salary here? Nope, no salary. Next job is also, well, actually, this is with Pine Park Health. They're hiring for an RN that is remote. As you can see here, this position is for Arizona, Phoenix, Arizona, then Boise, Idaho, Dallas, Texas, Las Vegas, Nevada. The next position, the next company is GBIT, and they're looking for a nursing informatics, electronic health records remote. This is a full-time job. It says any location remote. Now for this one, you must have a public trust or other SSBI T5, and they want you to have 8 years experience. No U.S. citizenship required. Okay, that's interesting. So for U.S. citizenship required, it has no. And the qualifications is bachelor's degree or equivalent combination of education and experience, 8 years experience supporting medium to large IT projects, knowledge of Indian health services workflows, extensive knowledge of Oracle health platforms and electronic health record systems. Make sure you add your Epic, Meditech, Protouch, etc. on your resume. Specific knowledge in inpatient surgery or women health workflows, proficiency with clinical decision support tools, workflow automation, and clinical documentation tools, experience working in nursing informatics or a clinical setting with health IT experience, proficient in Microsoft products, strong critical thinking and problem-solving skills with the ability to analyze and synthesize technical and clinical information, excellent communication and interpersonal skills to engage nursing teams and leadership effectively, ability to travel up to 25% of the year if needed. They don't exactly say where you're going to be traveling to. You must be able to obtain and maintain a public trust level 5 clearance. This job is full flex work week to own your priorities at work and at home. Very nice. The salary is also very nice. $123,000 to $166,000. 40 hours a week. Travel required is 10 to 25%, and you can work any location remote. The next position, this is with Pivotal Placement. This is a RN DRG clinical auditor position. It is full-time. The qualifications for this job, also the salary is $95,000 to $105,000. The qualification must be an RN, a minimum of 1 year of recent DRG auditing experience in a hospital or health plan setting, inpatient ICD-10 coding experience required. And let's see, CDI candidates are encouraged to apply if you have national coding certification through AHIMA or AAPC. That is preferred. CCS or CIC strongly preferred. Proficient in Microsoft Office and APR DRG methodology. Familiarity with coding clinic citations and official coding guidelines. Strong understanding of Medicare or CMS documentation requirements. And proficient in Microsoft Office Suite. The salary is $90,000 to $204,000. Next job, still with Pivotal Placement. This is a DRG coder clinical auditor. This is also remote. Salary is $95,000 to $105,000. Qualifications for this job includes, of course, an RN. Non-RN candidates will not be considered. 2 years experience, recent experience, DRG quality auditing experience in hospital or health plan setting. Extensive hands-on inpatient ICD-10 CM and ICD-10 PCS coding experience required. National coding certification required, AHIMA or AAPC, so on and so forth. You can read this at your leisure, and the salary is $90,000 to $104,000. This next job is also with Pivotal Placement. This is an RN coder. Salary is $95,000 to $105,000. It is remote and full-time. You must be an LPN, LVN, or RN, or an RHIT credential for non-nurses. So non-nurses can apply if you have an RHIT credential. 1 year of recent DRG auditing experience in a hospital or health plan setting. Inpatient ICD-10 coding experience required. CDI candidates are encouraged to apply. This has the same exact requirements as the previous job. On to the next one. This is Davies. Davies is hiring an RN telephonic nurse case manager. This is full time. The second compensation is $78,000 to $83,000 per year. The qualifications: must have an active unrestricted RN license, at least 3 years clinical experience, the bedside, it's med surg, orthopedic, neurological, ICCU, industrial, ER, or occupational health. Workers' compensation case management experience preferred. This is not required. Strong knowledge and treatment guidelines and utilization management principles. Excellent verbal and written communication skills. I'll let you read the rest of these bullet points at your leisure. And that is that for this job. Next company, this is Sprinter Health, looking for a clinical manager virtual care. This is remote, US, full-time, and this is for nurse practitioners, looks like. Salary is $130,000 to $145,000, and the requirements, of course, a board-certified nurse practitioner, active and unrestricted nurse practitioner license, multi-state or compact state preferred, 5 to 7 years of clinical nurse practitioner experience with at least 2 years in direct people leadership. Strong knowledge of HCC coding, risk adjustment, and meet MEAT documentation standards. Experience overseeing documentation quality through audits and reviews. I will let you read over this at your leisure. And this is with Sprinter Health. The next job is a family nurse practitioner. This is remote for Louisiana licensed nurse practitioners. This is full-time. Compensation is $110,000 to $115,000. And the qualifications, of course, are board certified as a family nurse practitioner in Texas, Louisiana, and or Oklahoma license, active family nurse practitioner license in California, consistently exhibits the highest levels of professionalism, integrity, accountability, confidentiality, care, and compassion to provide high quality health services. And I will let you read the rest of these bullet points at your leisure. Next job is with also Sprinter, family nurse practitioner, remote, Ohio license. This is a full-time position, $110,000 to $115,000. And the qualifications, of course, are board certified as a family nurse practitioner in Texas, Louisiana, and or Oklahoma license. Active family nurse practitioner license in California, and the same exact requirements for the previous job. Next company, this is with Cottingham and Butler Insurance Services. This is a RN case manager. It says on site for Iowa, but if you don't live in Iowa, they're also accepting remote applicants. You'll be RN case manager. Qualifications here: ability to speak Spanish is strongly preferred. RN license in the state of Iowa is required. BSN or higher preferred. 2 years of clinical experience, case management or utilization review experience strongly preferred, but not required. And there's no salary information here. Next job with Cottingham and Butler Insurance is a utilization management assistant. Now, this is a utilization management assistant, and this is for, it says on-site, but if you live here in Iowa, they also accept remote applicants. Now, this one, you must be a CNA, LPN, or medical assistant preferred, a background in patient health support or care, and 1+ years of experience within this field. And the next job we'll go to is Gallagher Bassett. This is a concierge nurse consultant. The job is $64,000 to $96,000 per year. It says location Franklin, Tennessee. It's a fully remote worker position. Qualifications: required degree from applicable program of training and a minimum of 3 years clinical experience in an acute care setting required. Active RN license or equivalent within the state of practice or states in which CM is performed. And bachelor's degree is preferred. Workers' compensation preferred, and certification in related field is preferred. This is Personify Health. They're looking for a utilization review nurse, LVN or LPN. And this was posted, it's like 5 hours ago, and it is full time. And you'll be working the weekdays, 8 a.m. to 5 p.m. Pacific time, with rotating weekend coverage as required. And you must be a current LVN license in the United States or U.S. territory. 1+ years of clinical experience required. That means just 1 year of bedside experience. And required knowledge include medical claims, ICD-10, CPT, HCPCS coding, HCPCS coding, proficiency in software applications, including not limited Microsoft Word, Microsoft Excel, PowerPoint, and Outlook. I have worked in utilization review for over 9 years and have never had to use PowerPoint on the job. Excellent verbal and written communication skills, and ability to speak clearly and convey complex or technical information in a manner that others can understand, as well as ability to understand and interpret complex information from others. And that is that for this job. And the next job would personify is the utilization review nurse, or in part-time. This position is, of course, part-time, and the qualifications are in license in the U.S. or U.S. territory. A associate's degree or diploma is required. 1 year of clinical experience required, and they want you to have the same exact technical skills, knowledge, skills, and abilities as a previous job, and constant use of computer keyboard and mouse. And it does not mention anything about, here we go. Here's the salary, 30 to 38 per hour, and part-time employees are not eligible for health benefits. I do want to mention that whenever you are editing your resume, you want to include what you did, why it's important, and how it relates to the job that you want.